Assalamu alaikum. Welcome to Ramadan for Better Health. This is a special program that we've set aside to talk about issues of health to ensure that we can be successful in our fasting month of Ramadan. This is not something that we have but once a year. And so inshallah we can be successful and learn something new to be successful in successive years if Allah grants us life, inshallah. Today we're going to be opening a subject, a mental health discussion about a very serious mental health condition called ADHD, Attention Deficit Hyperactivity Disorder. We're joined by a doctor who's specialized in neuropsychiatry. This is Dr. Gaffer, Muhammad Gaffer. Assalamu alaikum to you, Dr. Gaffer.
Wa alaikum assalam. Happy Ramadan for all people around the world and all Muslims.
Thank you so much for joining us. Thanks. Okay, so we're talking about how attention deficit hyperactivity disorder.
Yes.
What is it and how serious is it?
Yeah, attention deficit hyperactivity disorder, not only disorder, not only disease, not only syndrome. This disease is a group of all this. That means attention deficit hyperactivity or impulsivity disorder, not only affecting children, also affecting adolescents and adults. So this is highly serious disease interfering with quality of life for those people and affecting social, occupational pattern of their life. They may lead to severe social and occupational deterioration. That's why ADHD is not easily disease. This is highly serious, interfering with our life.
Okay, so ADHD, is it rightfully classified as a personality disorder or a psychiatric disease?
ADHD by name is a psychiatric disease, but there is some sort of personality problems: hyperactive personality, not attentive personality, compulsive, impulsive personality, antisocial personality, conduct disorders. These disorders or personality traits maybe are subgroups, and all they are involved in ADHD, attention deficit hyperactivity disorder.
All right, so we're talking about a human population of a little more than 7 billion now.
Yeah.
Out of this, what are the international standards, the percentages of humans who have this problem?
Yes. You can imagine for about 5 up to 8% of children in school are children with ADHD.
Okay.
Up to 80% from these children are proceed in ADHD to develop adult ADHD or to develop highly serious psychiatric comorbidities, maybe schizophrenia, maybe conduct disorder, maybe antisocial personality, maybe bipolar disorder, and even major depressive disorder.
So if I understand you, you're saying that ADHD could be the first stage into a much deeper, more serious psychiatric disorder.
Yeah, yeah.
All right, so let's talk about the causes. What causes a person to have ADHD?
Yeah, all psychiatric diseases, not only ADHD, are biological.
Okay.
Not only biological, genetic, not only genetic, anatomical, not only anatomical, neurochemical, not only neurochemical, but also even psychosocial. Well, what I want to say, I want to say the causes of ADHD are genetic, environmental, anatomical, neurochemical, and psychosocial. Genetics, the identical twins are highly susceptible for developing ADHD from more than other people. Highly genetics. Maybe ADHD will proceed and run in a first degree relative. This disorders is X-linked. That means disorders are more frequently affecting males than females. This is genetic. What about anatomical? This disorder is anatomical disorder in brain. really.
Sorry, before you say
Yeah.
more about the anatomical
Yeah.
part of it,
Yes.
this word anatomical, it means the structure of the brain, right?
Yes, this is a very interesting point.
Okay.
Anatomical does not only mean destruction, but also mean pathology.
Hmm.
Pathology, disturbance or pathology in frontal lobe, temporal lobe, hippocampus. These lobes are highly important lobes in cerebral cortex. This is anatomical.
Yeah.
Well, what about neurochemical? The defect of ADHD usually means defect in dopamine. Dopamine, yeah.
This is a hormone.
Yes, this is hormone released from cerebral cortex and the basal ganglia of the brain. Well, this dopamine is very important for better mental health. Once dopamine is defect in orbitofrontal surface of frontal cortex, you will develop attention deficit hyperactivity disorder. Not only dopamine, but the precursors of dopamine also, I mean catecholamine, epinephrine, norepinephrine, also are hormones, neurochemical transmitters released in higher cerebral cortex and the basal ganglia of the brain. The effect of them may lead to ADHD.
All right.
But I don't want to talk about anatomical, genetics, neurochemical. I want to talk more about psychosocial hazards, psychosocial issues that may lead to ADHD.
Okay, Dr. Gaffer,
Well,
let's put up for the viewers, let's put up some visuals so that they can follow us can you talk about this video that we're going to put up on the screen here?
Yeah. Yes.
Here.
This is to interpret and to learn us how much ADHD is very important disease and interrupting our life. This video will clarify that. Well, look at this man. He can't focus his
Tapping
attention.
his foot.
Yes, he is tapping his foot. That means defect in attention, also defect in activity. Well, look at his movements.
Yeah, hyperactive.
Yes, this is hyperactive, not goal directed. This is a problem. If you're hyperactive and goal directed, that's very good. But he is hyperactive, aimless hyperactivity. When not recognized or diagnosed, ADHD can be mistaken for countless personality traits or character flaws,
Such
such as conduct disorder, such as autistic spectrum, such as antisocial personality, maybe intellectual disability or mental retardation. Well, ADHD subtypes, the man or child with ADHD may be inattentive or hyperactive or compulsive or both of them. He
These
is
are
careless.
lists of symptoms. Yeah?
Yes, he is careless, short attention, doesn't seem to listen, failure to finish his work, difficult organizing task, avoids sustained mental effort, loses objects needed for completing his activities. This is not attention. Well, what about hyperactivity disorder? Hyperactive, if it gets, doesn't stay seated, excessive restlessness, difficult playing quality, always going, never calms down, talks excessively. Well, he not only hyperactive, but also he impulsive. He cannot wait for his turn. He will interrupt other people in talking, in listening, also in activity.
So we have the origins of the word itself.
Yeah.
They're going to give us the etiology.
We talked about the etiology of ADHD. As I told you before, ADHD is multifactorial psychiatric diseases. This is for viewing cerebral cortex. Dopamine deficiency, as I told you. Low arousal or external stimuli, working memory deficit.
This is the molecule of the
Yes,
dopamine.
this is a molecule of dopamine. Yeah, you have to focus on this. In ADHD, you have to look at this subject with much low areas of dopamine in comparison to control subject, which always be normal subject. Dopamine is responsible for pleasure, for attention, for motivation, for concentration. Mainly, this is a highly important neurochemical transmitters.
Yeah. So it sounds like it's a measurable, it's not subjective, determining whether or not somebody has ADHD. It's something that you can measure.
Yes, yes. Well, in all psychiatric diseases, how can you diagnose people with psychiatric diseases? You need criteria, you need symptoms and signs fulfilling specific time period. Well, to diagnose child with ADHD, the symptoms and signs must fulfill for at least 6 months. Before 6 months, there is no ADHD. Well, 6 months at least for attention deficit, hyperactivity, impulsivity, compulsivity. Well, you now getting the child or people with ADHD.
All right. We will take a break now, Dr. Gaffer. We will be back after just a few minutes. Assalamu alaikum. Assalamu alaikum. Welcome back to the program Ramadan for Better Health. We've been talking about a mental or a psychiatric disorder, disease with a neuroscientist. This is Dr. Gaffer, Muhammad Gaffer, talking about ADHD, Attention Deficit Hyperactivity Disorder. Dr. Gaffer, let's relate this condition to the life of the Muslim. This program is dedicated to Ramadan.
Yeah.
We've been giving a baseline foundation to help understand the condition. Now let's relate it to the life of the Muslim.
Yes. ADHD hazarding our life, hazarding the people with ADHD, not only in Ramadan, but also all over the year. The people with ADHD are suffering from learning disability, decision making, also social troubles with their brothers or their wives, or their parents, or their colleagues. Well, they cannot stand for a long time for relating Quran, as example. Well, they cannot stand, they cannot pay much time for prayer. As you know, in Ramadan, there is Al-Taraweeh. In Al-Taraweeh, you are standing for about 2 to 3 hours. Well, these people cannot stand for these hours because their problem, not only in their legs, but also in their mind. So they cannot relate the Quran. They cannot perform prayer. Also, they cannot tolerate other people or can deal with them in fasting as much. Well, in Ramadan, you are fasting for about from 60 to 70 hours.
16 to 17.
16 to 17 hours. Do you think or imagine the people with the ADHD can tolerate or can be patient for about 16 hours? That's so hard as regarding them.
More difficult.
Yes, this is highly difficult. The people with ADHD, much of them, for about 80 up to 90% are smokers. Well, they cannot tolerate offing or stopping smoking in the nahar or the day of fasting in Ramadan. So the people with ADHD cannot perform the sha'ira of fasting in perfect way. Maybe many of them cannot perform fasting at all. Many of them cannot perform prayer at all. So we have to spot more light for those people to make their life better in Ramadan and also around Ramadan and for the year.
This is very, I see now that this is very important to be able to identify people with this condition because it directly relates to their spiritual status with Allah. And performing the religious duties to Allah can be prohibited or frustrated by this condition. So that makes it very important.
Yes, it's very important in Ramadan to spotlight on ADHD and the other psychiatric diseases that may hazarding fasting.
Okay, so we've talked about, you said that in the general human population, between 5 to 8% of the people have this condition.
Yes.
You also said that children who have it, there's a good chance that they'll continue in adulthood with ADHD, and that could potentially develop more severe conditions, different kinds of conditions.
Yes. Frankly, the problem or the comorbidity of ADHD, not only in the ADHD in itself. Well, as I say, from about 5 to 8% of children or schoolers are suffering from ADHD, up to 60 up to 80% continuing ADHD in their adolescence, adulthood. Also, they may develop highly serious psychiatric diseases and personality traits, such as substance use. Up to 70% of people or children with ADHD continuing their life with drugs. Not only the overprescription drugs, off-label drugs, cocaine, heroin, even alcohol. Yes, even alcohol. Not only drug abuse, but psychiatric diseases such like major depression, bipolar disorder, another psychiatric diseases that interrupt their life and lead to more deterioration in social and occupational aspects of life.
Now we know that everyone who potentially has this doesn't have the benefit or the privilege of working with a doctor. So let's talk a little bit about the treatments. Once someone is identified as a victim, is it right to say a victim or patient of ADHD? What are some of the remedies?
Well, let's make a charity or a treaty. The psychiatric diseases, well, biological aspects, psychological aspects, spiritual aspects, and biological aspects. Well, for treating people with ADHD and patients with ADHD, you have to prescribe medication. But when you just prescribe medication, well, you don't add more for these people. Just you will decrease the comorbidity of attention deficit and hyperactivity. Well, what do you need also? You need psychosocial treatment for those people to make their life better. Well, to decrease the destruction of social and occupational deterioration. Well, to make them healthy people through psychosocial treatment. Well, you mean biological treatment by brain stimulants and non-brain stimulants. Well, also you need psychosocial program for these people to make them better and make them healthy, not only medication.
Okay, so we have another visual that I'd like you to direct your attention to. Can you talk about this?
Yes, this is for illustrate the hazard for ADHD. Well, ADHD personality, ADHD emotional, ADHD behavior, ADHD social media. This is for illustrating the etiology for ADHD, maybe in personality, maybe in emotional, maybe behavior, and also maybe in school, culture, media. This is not only the etiology.
So these are, like you were telling us earlier, these are some of the causes that lead up to...
Yes. Also, this is not only the causes, but also these complications. Well, people or patients with ADHD have troubles or problem in school, in job, in their personality, in their relations, in their emotions, also in their behavior. You can imagine man with all this problem. How can he look? How can he see?
Yeah. All right. So about 5 to 8% get diagnosed, which means that probably the majority of people, is it true that they go undiagnosed in life?
Yeah. Unfortunately, not in Egypt or on Arabic nations, but also all over the world.
Yeah.
Many people or many patients with psychiatric comorbidity are completing their life undiagnosed. So many people are frustrated, are suffering from failure because they are not diagnosed. They don't visit the psychiatrist for medical treatment, for psychological treatment. Well, look at this picture. This child, he is a child with hyperactivity.
Yeah.
He cannot tolerate sitting at his as the students, and he look like hyperactive as we see in this photo.
So we don't want to say, I mean, some people in our families, some of our colleagues are difficult to work with. It doesn't necessarily mean that they have some kind of a condition. So we don't want to jump to that conclusion. You know, there could be many reasons for that. So maybe they just didn't get enough sleep the night before.
Yes.
But when we look at some of the psychosocial causes, and you consider the fact that many Arab Muslims are suffering right now in places like Syria and Palestine and Libya, can you imagine, I mean, the young people who are growing up in these environments, what do you think in terms of the likelihood that they'll, you know, possibly get this kind of...
Yes. In our nations, we have 6 countries, as you said, or even more, unfortunately, suffering from war and the hazards of war. So this will affect parents, also affecting in a child, even adults, male or female. Well, that will lead in direct effect on them or indirect effect. I would like to focus on indirect effect.
Indirect,
what is indirect effect? Indirect effect, that effect upon parents that will lead to hazards in child. Well, people in Arab nations, especially in nations suffering from war, may be showing highly expressed emotional behavior.
Yeah.
So what is highly expressed emotional behavior? I said from causes of ADHD is psychosocial troubles, psychosocial problems lead to development of ADHD. Not only ADHD, but also many psychiatric and not psychiatric diseases is emotional parents or emotional families, highly expressed emotional families. Highly expressed emotional families are overprotective or over hostility or over criticism. Well, you can imagine parents with highly criticism or highly protection for people, for children. So what is the impact? You will get psychosocial problems that may lead to affection of those children with attention deficit hyperactivity disorders.
Yeah.
Well, in treatment especially the behavior treatment for children with ADHD, you have to treat parents only. Yeah, you not treat the children only. No. You have to treat the parents because you will find them highly expressed emotional parents.
Yeah, creating the condition that could lead to ADHD. Dr. Jaffer, Mohammed Jaffer, he is a neuropsychiatrist, and he's been joining us talking about this psychiatric disorder, attention deficit hyperactivity disorder. We appreciate you for joining us,
Thank you so much.
Doctor.
Thank you so much. And happy Ramadan.
Yeah, thank you. And
you.
Ramadan, happy Ramadan to you as well. We will close out the program for today. We'll be back, inshallah, with more of the program, Ramadan for Better Health. Assalamu alaikum wa rahmatullahi wa barakatuh.